Hi, hello everyone. Today we will discuss anticoagulants, various anticoagulants that are used in the laboratory. Anticoagulants keep the blood from clotting or turning into solid clumps of cells that stick together. Most come in the pill form. The blood thinners are given as a shot or intravenous. Thinners that are used are heparin, warfarin. Laboratory use: ethylene, diamine, tetraestic acid (EDTA) strongly and irreversibly chelates or binds the calcium ions, preventing blood from clotting. Citrate is in liquid form in the tube and is used for coagulation tests as well as in blood transfusion bag. Oxalates has a mechanism similar to that of the citrates. The anticoagulants are double oxalates, ethylene diamine tetraestic acid, heparin, sodium citrate, sodium fluoride. First, we will discuss double oxalates. 0.5 anticoagulant for 5 ml of blood. This anticoagulant removes the free calcium ions from the solutions through the addition of ammonium and potassium oxalate. Calcium is precipitated as insoluble calcium oxalate. Preparation: 1 to 2 grams of ammonium oxalate and 0.8 grams of potassium oxalate are dissolved in 100 ml of distilled water. 0.5 ml of this solution is added to each of a series of tubes and evaporated to dryness at 37 degrees centigrade. Use: blood taken into this anticoagulant is unsuitable for the morphological examination of the red cells, and the white exhibit bizarre nuclear patterns. Next anticoagulant for discussion is ethylene diamine tetraestic acid (EDTA). EDTA can be found in three salt forms: dipotassium EDTA, disodium EDTA, dilithium EDTA. EDTA can be crystalline or liquid. Liquid EDTA tubes require specific filling volume to avoid the dilution effect. Blood is to anticoagulant ratio must be maintained. This is applicable for all the anticoagulants. EDTA is also known as Versene, Versene, or sequestrine, Sequestrene. EDTA acts by chelating or removing the ionized calcium, and the calcium is required for blood to clot. So when it is removed, the blood will not clot. Dry potassium EDTA is better than the dry sodium EDTA and dilithium EDTA. Always be sure to mix blood with the anticoagulant in a manner that guarantee proper complete mixing by gently repeated inversion of the tubes. Inversion for at least 20 times. Do not shake or use vigorous inversion, since this may cause hemolysis and disintegration of the cell, and the final effect will be erroneous, low results for cellular components of blood. EDTA is the most commonly used anticoagulant in the hematology laboratory, and it is the anticoagulant of choice for the complete blood count. Excess EDTA, that is more EDTA, you will feel less blood volume. So EDTA is an excess will cause shrinkage of the RBCs, causing falsely or erroneously reduced hematocrit and subsequent increase in the MCHC and decrease in MCV. Platelets are also affected. They will swell and subsequently disintegrate, causing erroneously high platelet count. Since platelets will be disintegrated into more than one fragment, and each fragment will be counted as one platelet. Heparin. Heparin is an acid mucopolysaccharide, and it acts by complexing with antithrombin to prevent the blood clotting. Antithrombin is one of the natural or physiological inhibitors of blood coagulation. It is not suitable for blood film staining, since it gives too blue coloration to the background when films are stained with the Romanowsky stain. Also, heparin may cause leukocyte and platelet clumping. This is why heparin is not suitable for the routine hematology. Heparin is the preferred anticoagulant for osmotic fragility test. Heparin is also used in capillary tubes for spun hematocrit. Heparin cover the entire capillary tube glass. These capillary tubes are also called as microhematocrit capillary tube. Heparin is also used in LE cell preparation, lupus erythematosus. Heparin is found in basophils and mast cell granules. Heparin is used therapeutically as an in vivo anticoagulant. The anticoagulants that are commonly used in the hematology laboratory has a universal color. EDTA used for routine hematology procedures is lavender. Sodium citrate used for coagulation and platelet tests and also for ESR. It will be with blue. Heparin is used for osmotic fragility and spun hematocrit. It may be available in green and brown. Preparation of heparin. 0.4 grams of prepared heparin is dissolved in 100 ml of distilled water. 0.25 ml of this solution is added to each of a series tubes and evaporated to dryness of 37 degrees centigrade. Sodium citrate. This is the most commonly used anticoagulant, mainly used to prepare citrated plasma for the evaluation of coagulation disorders, as it is not inhibitory to the calcium ions. Sodium citrate is the anticoagulant of choice for coagulation and platelet function tests and also used for erythrocyte sedimentation rate. It acts by precipitating the calcium. Thus, it will not be available for the clotting process. Sodium citrate came in a liquid form as 3.8% trisodium citrate. For coagulation testing, the ratio of 9 volumes of blood to 1 volume of anticoagulant. Blood to anticoagulant ratio is 9:1. Is very critical and very important as variation from this ratio may cause errors. For ESR, volumes of blood to volume of anticoagulant should be in the ratio of 4:1. Generally, this anticoagulant is not suitable for routine hematology testing. Sodium citrate acts as an anticoagulant and as diluted as in the case of ESR. Because of its dilution effect, it cannot be used for CBC, complete blood count. Preparation of sodium citrate. 3.8 grams of trisodium citrate is dissolved in 100 ml of distilled water. Sodium fluoride. This anticoagulant is used for preparing blood specimens for the determination of glucose and urea in plasma by non-enzymatic methods. Fluorides inhibits the glycolytic enzymes and thereby prevents loss of glucose during transportation or delay in specimen handling. As fluoride is not a strong anticoagulant, it is mixed with the oxalates. Thank you for the patient listening.